The administration has said things like butter is healthy, and they've said things like beef tallow is healthy, which is not consistent with what the dietary guidelines have indicated. And so what does that mean in terms of how the FDA healthy claim is going to need to be stated?
Hello and welcome to FDA Watch. I'm Wayne Pines. We're the only independent, nonpartisan forum dedicated to discussing the latest developments at FDA. I want to remind you, if you haven't subscribed to our podcast, you can do so today. Go to fdawatch.net. You'll get an email when a new episode appears, including bonus episodes. We're especially involved right now in our ongoing series on medical devices with the law firm Covington, and we're going to have 3 more episodes with them. Plus, you'll get quick access to our headlines and resource links. In this episode, we're going to talk about foods. We have 2 great guests standing by. First, let's get to some headlines, some recent developments. In late January, FDA says its ImportShield Program, which is a centralized import review system launched in August, increased processing speed by about 66%. It boosted monthly volume capacity by a third, by 33%, and it reduced staff hours by 20%. And it saved an estimated 3,300 work hours per month. We'll see if this reported success continues. The program is known as the National Entry Review Program. From the Pharma desk, 2 items. FDA and the European Medicines Agency jointly issued 10 guiding principles intended to inform how AI should be used throughout the drug and biologics development cycle. The principles cover a lot of factors. As those of you who are following our podcast know, we covered AI last year with the law firm Arnold & Porter, and I've talked about AI in virtually all of our episodes. These high-level principles are intended to help industry and product developers consider good practices when they're applying AI to generate or analyze evidence in drug development. Very important development. And then the second item, FDA just published the applications for its pre-check program. This is a program in which pharma companies who are investing in new facilities in the U.S. can get priority attention and assistance from the agency. FDA said 7 companies would be selected for the process, and applications are due at the end of February. We'll see how that works out. But as you all know, we've talked about it. President Trump is trying to bring pharma manufacturing back to the U.S. From the devices desk, FDA is increasing scrutiny of direct-to-consumer self-collection kits by treating certain collection devices as medical devices that currently lack agency authorization. FDA's action stems from its view it retains authority over these kits despite a court vacating the lab-developed test rule, which we talked about in a previous episode, and the agency has cited compliance issues in warning letters to some firms. This development may signal that manufacturers and distributors of self-collection products may face greater enforcement and the need for pre-market submission. Again, we just talked about laboratory-developed tests in one of our current series with Covington, and we encourage listeners to listen to that episode. You can hear that episode by going to our website, fdawatch.net. From the foods desk, and we're going to be talking about foods for the rest of this episode. The Human Foods Program released its priority deliverables for 2026, covers 3 core areas: food chemical safety, nutrition, microbiological food safety. This is what basically we're going to be talking about during this episode today. From the cosmetics desk, as we await further moves from FDA in cosmetics regulatory oversight, we'll share some news about a recall by the agency. It involved cosmetic products distributed by Gold Star Distribution of Minneapolis. The products were found to have been exposed to rodents and rodent activity at Gold Star's distribution facility. The recall applies to all cosmetic products distributed from that facility. So again, we're continuing to watch major recalls, and this is certainly one that we're going to be paying attention to on the cosmetic side. Let's meet our guests. Both have previously been on our podcast. David Lennarz is president of Registrar Corp. He manages the company's overseas operations. He's worked for more than 2 decades in FDA-regulated industries in both the U.S. and in Europe. When we talked with David last time, he talked about cosmetics, but he's here today to talk about foods, an area that he's very, very well versed in. Welcome back to FDA Watch, David.
Thanks, Wayne. Appreciate it.
Joining us today is Dr. Susan Mayne. Everybody in the food area knows her name. She's currently an adjunct professor at the Yale School of Public Health, where she's been for several decades, but she took some time off from 2015 to 2023. She was director of the CFSAN, the Center for Food Safety and Applied Nutrition. We see her postings on LinkedIn all the time. Very, very educational. Welcome back, Susan.
Pleasure to be with you, Wayne.
So let's talk food. Let's start by talking about the Human Foods Agenda for 2026. FDA recently released its priorities. So Susan, let me start with you. Could you summarize just very briefly what the agenda calls for, but more specifically, what's your view on the food program's agenda for 2026?
Happy to, Wayne. So as you said, it's really bucketed into the 3 main areas, and interested listeners can go to the FDA website and see the details in each of those 3 main areas. But I think at a high level, one of the reactions I had is that much of what they're committing to get accomplished in 2026 is not really regulatory as much as it is in many other areas: consumer education, research, plan to do something, develop a strategy. There's a number of those types of deliverables that are in the program. From a regulatory perspective, it's thinner in terms of regulations and guidances. The big one that many people are looking forward to is the one related to GRAS, that generally recognize a safe program through the Food Additives Group at FDA. And what they've stated is that they will be releasing a proposed rule that would require industry not to be able to do self-certification of GRAS, but rather to notify FDA about these GRAS determinations. And the details are still TBD. But that is a proposed rule that everybody's looking forward to. There's also some guidances, things like action levels for arsenic and cadmium. That's a guidance around natural color additives. A guidance on food labeling and online grocery shopping, and then some deregulatory work, for example, standards of identity. So it's a thinner portfolio, I'd say, on the regs and guidances, but certainly a lot of planning and research and education, working with states, et cetera. And that was my high level reaction, and we can get into some of the individual deliverables, Wayne.
Right. David, any perspective on the agenda?
No, I think I'd say from a consumer standpoint, to touch upon what Susan just said, the areas, the online, labeling around food products being sold online, I think are particularly interesting for consumers, and the front of package labeling. If you've been to Europe, you've seen some of the simple ways in Europe that products are identified as being healthy and such. And so, this proposal around the front of packaging nutrition labeling is I think an effort to move in that direction to make it easier for consumers to quickly identify, added sugar, sodium, and so forth. So I think those are interesting. And obviously, both of those have a pretty big impact on industry. Anytime you start messing with a manufacturer's product labeling, it can involve, literally, millions of dollars in having to make changes like that to their product packaging. So I think those are kind of interesting ones, both for consumers, beneficial, and again, it'll be interesting to see how far that goes because of the impact on industry as well.
Susan, does FDA have enough people to actually implement what they're talking about doing? Or, I don't know what percentage of the staff in the food area, uh, you know, no longer is there because of the cutbacks that they've had. Are there enough people left?
Yeah, we have seen some decreases across the FDA broadly, and that does include the Human Foods Program. I think some of the key departures that really do concern is some of the high-level leaders, on those most experienced folks, and that's especially true on the inspectorate side. So that's an area as they're trying to cover the inspections and in the microbial food safety program, working with states, training. A lot of big changes there, and that's going to be an interesting one to see how that's done. The whole training arm of the inspectorate was taken down. And so those are some of the changes we'll see coming. They still have a lot of the key offices functioning. Whether they can get through all this work will remain to be seen. I'd say the foods program has always been under-resourced, including in my time at the FDA. And I knew we could never get through. We had to prioritize all the time. That's going to be a bit more acute now because their numbers are down across the board in the foods program. So that will remain to be seen how they're going to execute that with fewer people than they had before.
Do you think that the fact that FDA has fewer people in the program affects the safety of our foods across the country?
Well, I think what we're seeing is cutbacks in a lot of the resources. So as FDA has to cut resources, that means they're going to cut things like sampling programs. That means they're going to cut the amount of money they can spend to the states to do sampling programs. And a lot of the microbial contamination we find comes out of some of those sampling programs. It's also not unknown to industry when FDA is doing the sampling, and industry doubles down on food safety when they know that FDA is going to be sampling and watching. And we've seen that through the microbial testing programs that FDA has done. We tend to get the highest microbial violation rates at the beginning of a sampling assignment, and we get better performance as the sampling assignment goes on. And most people believe that that means the industry is really paying attention because they know FDA is. So as resources get cut, it's not just the people, but it's all those related programs that are going to also be resource constrained. And that includes to the states. The states have had inadequate funding to do their part of the work, and it's come from FDA. But as FDA's budgets are cut, the states are going to see cuts as well. The administration has said that they want the states to take on more in terms of the routine food inspections. Will they be adequately resourced to do that? Those are some of the big questions I think we all have.
Let me shift gears for a second, talk about the food pyramid. There was an enormous amount of publicity about the food pyramid. Again, I'm going to ask to turn to Susan first. Describe very briefly, I don't want to go into the details because people have been reading about it, about the pyramid itself, but what is it used for? What are the practical implications of changes in the food pyramid?
Yeah, so the food pyramid is the graphic representation of the updated dietary guidelines for Americans. And it's mandated by Congress that the dietary guidelines be updated every 5 years. This was the 2025 to 2030 update. It wasn't released until 2026. It was actually overdue. But these are the dietary guidelines. And the importance of the dietary guidelines is they are really what we call the North Star for federal nutrition policy. And what that means is as the government does things like food assistance programs, they're meant to be consistent with the dietary guidelines. Things like nutrition labeling and other initiatives, school lunch programs, things like that, all have to be consistent with the dietary guidelines. And so it can drive more than just the food assistance programs, which is a huge part of it, but also some of FDA's work on labeling. So the dietary guidelines come out of HHS and USDA. FDA plays a role in developing the dietary guidelines, but it's really HHS and USDA to do that. But we can get into some of the ramifications I see now that we have the dietary guidelines out and how that's going to relate to some things that FDA has pledged to work on, things like front of pack nutrition labeling, things like implementing healthy. All of those may need to be adjusted to align with the updated dietary guidelines, so we can get into some of those discussions.
Yeah, David, dietary guidelines, food pyramid?
Honestly, from the perspective of our client base, not a lot of talk about it. Again, our clients are typically producing products, most of them outside the US, exporting them here. I think some of them might view, depending on where you sit in the area of manufacturing, as sort of beneficial and a win, and others not so much so. But from a practical standpoint, from industry, I don't think it certainly has not been front and center as a discussion point.
Yeah, so let me go back to Susan. You talked about the nutrition label. So how does the change in the dietary guidelines affect nutrition labeling, or could it affect nutrition labeling moving forward?
Yeah, a couple of examples. The first one was the nutrient content claim healthy, which was finalized. So that's a final rule that's already out there. And it basically said in order for a product to bear a healthy claim, it has to include a meaningful amount of the food groups that the dietary guidelines were encouraging, things like fruits and vegetables and whole grains and healthy oils and dairy, things like that, while minimizing saturated fat, added sugar, and sodium. But now that we have a new dietary guidelines, FDA stated as one of the things they'll be looking at in 2026 is whether they need to make changes to the healthy rule in order to make those better parallel the updated dietary guidelines. So the administration has said things like butter is healthy, and they've said things like beef tallow is healthy, which is not consistent with what the dietary guidelines have indicated. And so what does that mean in terms of how the FDA healthy claim is going to need to be stated? Will certain foods be exempt in some ways from some of the criteria in healthy? I don't know how they're going to administer it, but they have stated that is going to be part of their work for this year. The other one is the front of pack nutrition labeling that David raised. And FDA proposed it before, that products that were high in sodium, added sugars, and saturated fat would need to declare that on the label. It would say it's interpretive labeling, high, medium, low. The question is, how might that change now that the dietary guidelines are out there? Secretary Kennedy has pledged to end the war on saturated fat. So what are they going to do with saturated fat? Are they going to continue to declare products high in saturated fat? Would they exempt particular classes of products from front of pack nutrition labeling, given the Secretary's preferences about saturated fat? So there's some certain ramifications there. And the last thing I'll say at high level coming out of the dietary guidelines is one of the key messages is about eating real food. And I think one of the things the administration has been signaling for quite some time is that they're not very comfortable with food innovation. And so for companies that are really on that innovative cutting edge of food development, that's a bit of a red flag, a bit of a warning sign. The Secretary himself has indicated that he does not support things like cell-cultured meat. He's been advocating for a national ban, again, being more in favor of traditional meat products. So again, there's a strong signal there about supporting real food. At the same time, I'm expecting to see more anti-innovation. Plant-based products, for example, were pretty much absent from the dietary guidelines. There was a lot of promotion of dairy, specifically whole-fat dairy, but no mention of things like soy milk or fortified soy milk for people who don't wish to consume dairy. So we're going to see some potential messaging coming out of the administration, and companies that are working on that cutting edge of innovation need to be aware of the administration's positions and how that might impact some of their work.
Yeah, and from a nutritional standpoint, does that concern you? Does that, what is your view about the practical implication on the health of the American public because of the change in dietary guidelines and the implications that you just mentioned?
Yeah, it's a tricky one because the food pyramid that you have alluded to is actually internally in conflict with some of the verbiage in the dietary guidelines. So it shows a lot of imagery of very high saturated fat products, whole fat milk and beef and products like that, cheeses. They really dominate. They're given number one in the visuals in terms of rolling out the new food guidelines. But at the same time, the text says that they shouldn't be exceeding 10% of saturated fat. So what that means to me, 10% of calories coming from saturated fat, what that says to me is that for the federal food assistance programs, they're going to have to really limit those portions so that they don't exceed 10% of calories from saturated fat, and they'll have dietitians and folks making sure that that's the case. But for the average consumer, who I think is going to really struggle to try to calculate how much of their calories are coming from saturated fat, I think what we can expect to see is if people are influenced by that imagery, they'll be eating higher saturated fat diets that have been associated with higher risk of cardiovascular disease, and that does concern me. At the same time, it really de-emphasizes plant proteins and some of the high fiber sources like whole grains. So our country already eats far too little dietary fiber. If people really follow the imagery in the food pyramid, I'm concerned that will actually get worse and not better because whole grains are almost absent from the food pyramid, which is quite striking given that it's strong recognition that they're important foundations for healthy nutrition for our country.
Yeah, how is that monitored? What people are reading? Is that by the sale of foods in the supermarket? Like if we're measuring how much saturated fat an average American or the American public is consuming, how do we ever know that? Can we measure an increase or any change at all?
Yes.
There must be a lag time between the time that people are eating and the time we actually have data.
Yeah, so a couple things. The primary way that we do nutrition surveillance is through the National Health and Nutrition Examination Survey, which is done by the National Center for Health Statistics at CDC. And so they interview a probability sample of the U.S. population so that you can find out what people report they're eating. They also have a very big biomarker component, collecting blood, collect urine samples, collect certain medical records, even things like DEXA scans to look at bone density. So we have a pretty robust nutrition surveillance program for the population run out of the CDC. That's one way. The other way is to look at, purchasing practices and, as you said, ingredients and what's happening with food ingredients. That kind of information is going to be necessary for things like monitoring what's happening to the sodium concentrations of the U.S. food supply. So in order for FDA to do that work, to estimate how sodium reduction is going, they actually have to purchase food label database information that's more current and looking at changes in food composition labels over time. And that is one of the deliverables that FDA committed to for 2026. Is to really look and see how have the sodium reduction targets for industry been working. When I was there, our most preliminary estimates were around 12% reduction with the phase one initiatives. FDA stated it was about a 10% is what they're seeing, around 10%, but they're going to do the official assessment of the phase one sodium reduction targets using food composition data, purchasing patterns, et cetera, to try to estimate what's happening there.
Does that CDC program, as far as we know, still exist? Is it still robust?
That's an interesting question. They were one of the groups. The group that runs NHANES was one of the groups that was riffed not too long ago. But like many others, they were actually brought back. So that program was terminated at one point. There was enormous public outcry because NHANES is so foundational to our nutrition work. But those folks were brought back. So hopefully they will continue to be retained so that they can continue to do this important nutrition monitoring work at the CDC.
I want to shift gears. David, question for you. As we all recall, one of the initiatives in 2025 involved food dyes, petroleum-based dyes. Has there been any movement on this, and what's the latest going on with food dyes?
Well, we know that there is reviews going on, or we're told that FDA wants to complete reviews of additional natural colorants and evaluate those. So, I think right now what we've seen is nothing set in stone from a regulatory perspective, but a lot of talk around uh, uh, elimination or reduction in those petroleum-based food dyes. And of course, you saw companies react in a lot of cases. Some of the larger multinationals saying they would pull this particular ingredient. Um, but I think ultimately for that to really take hold beyond just some of these multinationals saying they'll do it, it will need to be, put into rulemaking eventually. So for it to really have any teeth or any lasting impact. So I would put it in the aspirational column right now until it gets a little further down or into actual promulgation of some rules around it. Companies will say they're going to do it, but ultimately, you know, change in administration that could very quickly revert and go away.
Do you see an appetite within the food industry to actually fulfill the commitments that they made, or is the delays in the rulemaking process just do they hope that it just drags on the way it is until there is
Yeah,
a change in policy?
to the extent that companies can avoid making changes, there's certainly appetite for not much to happen in this direction, right? I mean, it's a lot easier and what's a lot more cost effective for companies to not have to change anything on the production front. So I think generally for it to sort of drag on in a process is from an industry standpoint, companies are happy with that.
Susan, any perspective on the food dyes?
Yeah, I think the area where the food industry is really between a rock and a hard place has to do with many of the state laws that have been going on right now. Because at the federal level, it's voluntary, correct? It's a different world. But at the states, many of the states have actually passed legislation that would prohibit products with synthetic dyes coming into their school lunch programs or even into their state more broadly. And so that is a really challenging situation. And for industry, different states, different laws, different chemicals. It's really a very, very challenging role because no industry can deal with a patchwork of different state laws. Recently, the International Association of Color Manufacturers sued one of those states over that type of legislative work. And I think it's temporarily put it all on hold. And what they've stated is that FDA says these synthetic colors are safe. There's nothing in the scientific record that says they're not safe. So how can the state simply determine that they are poisonous or toxic in conflict with FDA's regulations? And so there'll be more to come with these synthetic colors, but I think the states are really what's driving all of the anxiety that I'm hearing about from industry at this moment in time. So more to come on that as we move forward.
I think that's true, Susan, as well in the cosmetic space, right? I mean, you're seeing a plethora of rule making at the state level around cosmetics in the cosmetic space as well, in addition to food.
Yeah, Susan, one final question on that, and that is you, of course, when you were at CIFSAN, uh, also saw conflicts between state laws and federal law. Every part of FDA sees that. How did you deal with that as a practical matter, as the head of CIFSAN or as the head of any center at FDA?
I think, as a federal employee, you're always reluctant to try to preempt something at the state level. I mean, I think, states have rights and, the courts and lawyers have to weigh in on all that. But I think the goal is not to try to preempt states from doing their work. But I think this is really, in my opinion, an unprecedented time. And every time you look at a map of how many states are now passing laws, I don't know what the current total is. It's like 35 different states now have different laws on the books with regard to either dyes or other ingredients. And that's simply a non-tenable situation for our food supply. So this is going to have to get ironed out one way or the other. It's interesting on the synthetic dyes that FDA asked for the voluntary removal before they decided to do the scientific evaluation. They were added to the list of new chemicals that they really wanted to scrutinize for safety, all of them on the same day in August last year of 2025. And that was about 4 months after they asked for the voluntary removal. FDA had done a lot to look at the safety of these, but now they have been added to this list. Saying that they're really going to scrutinize the safety of these, which is the opposite order from the way we would have done things when I was at CIFSAN. We would do the scientific evaluation first before seeking any type of a removal voluntarily or through regulatory processes. But I think that's where we are with these synthetic colors. It's a little bit of an odd situation asking the voluntary removal before they do the safety analysis.
David, any final
Well,
word
I
on
was going to
this?
ask more quick question for Susan then around that is, having been on the inside there and knowing how things were done, it seems to me that that reversal really kind of probably came from the top. Would you agree with that?
Absolutely. That was a politically driven reversal. Absolutely.
Right.
And Susan, asking you to put your science hat on. These food dyes, of course, were in foods when you were CIFSAN director. Is that really a health matter that is significant enough to be getting the attention that it's been getting?
Well, I think that the biggest concern about the synthetic food dyes is some weak data that suggests a possible impact on behavior in certain children. And so there has been observational data. Parents say, when my kids eat these food dyes, I find that they act worse, their behavior deteriorates. The problem with the observational data is that the food dyes track very closely with added sugars, and it's really hard to partition out if your kid's eating frosted cupcakes with lots of food dyes and their behavior is altered, is it due to the food dyes? There's also clinical trial data, most importantly, a study that was done in the UK that Commissioner Makary referred to at the press conference. It was a clinical trial where they used a couple of different beverages that had synthetic food dyes versus a placebo drink. The problem with interpreting the data is that they use synthetic dyes that are not even allowed in the U.S. food supply, along with some that were, along with other preservatives. And so it's really weak data, hard to interpret. When we were at FDA in 2011, they convened a food advisory committee to look at all the science and saying, what do you think of this data? And they said it's too weak to take any kind of a regulatory action. If parents want to avoid these dyes, they can, because they're mandatorily labeled in products. We also held a science board meeting when I was at the FDA to have the FDA science board weigh in on this particular topic, knowing it was getting so much public scrutiny. The science board concluded it needs more research, that there really isn't clear evidence that there's a causal link between synthetic food dyes and behavioral changes in certain children. So FDA has really followed the science, but we've seen in this case, it was saying, well, they don't do any good, so let's get them out of there. That's what we've heard the administration say. They don't have a particular function. But as a regulator, taking something out, you always have to think about what those unintended consequences may be, what will be replacing them. And that's where the whole discussion about natural food dyes comes in, and whether this will be a net gain for our public health or whether this will be a net loss. And so those are some of the issues that continue to come out of the discussion around synthetic food dyes.
And we'll see that continue to evolve in this new year. We're going to take a quick break now. Don't go anywhere. We'll be right back. We're back. chatting with David Lennarz from Registrar Corp and Susan Mayne, former head of CIFSAN, now at Yale School of Public Health. Susan, let me start with you. Talk about labeling. We talked a little bit about nutrition labeling before. FDA just put out an RFI on gluten ingredient disclosure in foods. What are your thoughts about that and about labeling in general? Where is it headed at the agency?
Yeah, for gluten, I think when I was at the FDA, it was an issue that certainly came in front of me. I met with many consumer advocates that really wanted FDA to mandate gluten labeling, to say that a product contains gluten. It gets a little tricky because of the authorities that FDA has. And to be more specific, under the Food Allergen Labeling and Consumer Protection Act, that's FALCBA. That's the one that Congress passed that mandated the 8 major allergens that now extended to sesame with the 9th. That law basically said that FDA could apply gluten-free labeling. So it gave FDA authority to do gluten-free labeling, which FDA has done. Basically, FDA did some analyses on how much gluten would need to be in a product to trigger a reaction, set essentially a threshold, 20 ppm, I recall, and then did a lot of food testing and to make sure that products that declared that they were gluten-free actually met that threshold. In the sampling that we did when I was at FDA, it was like 250 products, only one tested positive for having more than the 20 ppm gluten, and that was Cheerios, that had already been subject to a recall because of cross-contamination that had occurred. So it's a long way of saying that the agency has pursued the gluten-free label approach consistent with their authorities in order to mandate the presence of gluten. I would guess that the data that they get from this request for information could be helpful because they are presumably going to have to go to Congress and ask for explicit authority to mandate gluten labeling. So getting information from consumers where they've had problems and reactions based upon current labeling with things like, oats and barley and things like that. I think that will help the agency to potentially seek the direct authority that they need. So I do support, trying to make progress to help people who have gluten sensitivities, gluten intolerances. The path they're on is going to be a slow path, starting with an RFI. So we're a long way away. Unless Congress decides to take an action directly, even that takes time as it did with sesame. But I support that in terms of labeling.
Yeah, I want to talk about labeling generally, but help me understand why FDA needs congressional authority for gluten ingredient labeling.
Because it doesn't fall under the Food Allergen Labeling and Consumer Protection Act. It's not an IgE-mediated food allergy. It's really not necessarily a food allergy, right? So it has to do the technicalities of a food allergy. If FDA thinks that there's a safety reason to mandate labeling outside of the food allergen laws, then they can always mandate labeling. And I'm assuming that's part of the process in terms of why they're doing an RFI, to identify consumers that have potentially had adverse reactions. The current labeling is inadequate to protect consumers. I think that's what they're going to need to demonstrate. If they were going to do that, that would be a long rulemaking pathway, again, several years prior to mandating. If Congress decides to do it, it can be done much more quickly, and that's what happened with sesame. Congress added sesame to the Food Allergen Labeling Consumer Protection Act, which made it the 9th major allergen that had mandatory labeling.
Yeah, it seems as if the restaurants and the food manufacturers are ahead of FDA on this in terms of talking about gluten. Every time you go to a restaurant, you see gluten-free items on the menu. David, any comments on labeling in general, just where you see it headed at FDA and in the food area?
Well, I think again the big item will be the front of package piece. If that can get finalized and put into action, that will certainly have a significant impact for manufacturers. So I'd say that's the one to watch from my perspective, at least as far as our clients go.
And are they supportive of front of package labeling? It'll certainly involve a change in the package, in the labeling of all products, which is an expense in itself. But where is the industry on that?
I think that depends where you lie in the industry, where you are in the industry. So if you're in the, an area of producing healthier products, you may be real happy with that change. If you're not, you'd rather not have to change your label every 3 or 4 or 5 years.
Okay. I want to shift gears again and talk about infant formulas. Infant formula has been in the news, in the past few years more than ever in the past because of GMP, good manufacturing practice problems, and it continues to be front page news. We've certainly seen some what I would call disturbing recalls. Susan, what's going on at FDA with regard to infant formulas, and what are you watching? What do we hope happens in 2026 to make sure that when parents buy infant formula, they can feel confident?
Say that what I'm watching has a lot of interest in the food safety aspects of infant formula. We've had some very, very visible food safety problems, the most obvious one being the ByHeart recall for botulism. 51 infants were very sickened by botulism in that infant formula. FDA has been working on a root cause analysis, and it appears that the botulism was coming in from a whole milk ingredient that was being used in formula. And so the question is, how did that happen? Because whole milk is in, a lot of different products. Obviously, infants are more sensitive to botulism spores. So that's a big one, food safety. There's also been infant formula safety problems in the EU. There's been some very notable recalls. Products from Nestle, Lactalis, and Danone have been recalled for having something called cerulide in them, which comes from bacteria Bacillus cereus. So that's leading a lot of people to say, okay, now we've got botulism, we've got another concern with another bacteria, so really doubling down on infant formula safety. And I really think that's important because we have such a concentrated infant formula market in the United States. If any of those were to happen to an Abbott or, some of the big manufacturers, Reckitt, any of those, that could put us back into shortage situations. So that should be top of mind as food safety. The administration through Operation Stork Speed has really emphasized other aspects of infant formula, which I would prefer that they really focus on safety as well. They've talked about things like the nutrient requirements, updating those nutrient requirements. A lot of this comes from concerns about seed oils that the Make America Healthy Again group has had. Concerns about seed oils, but seed oils are in infant formulas as a source of essential fatty acids. So kind of addressing that through nutrient requirements is important. They've also talked about contaminants. We're seeing a lot of interest in states as well as in FDA about contaminants in infant formula, ranging from heavy metals, lead, arsenic, cadmium, mercury, also PFAS. So those are the things we're seeing in infant formula. So I expect it to be busy. It's a very small staff at FDA that works on infant formula, so they certainly got their work cut out for them. So I would not discount infant formula as an important part of FDA's work, especially if we have any more food safety issues like we've had so far.
David, I don't know whether you have any clients in the infant formula area. Any comments on that?
Yeah, we do. I think what's interesting, Susan, it's also kind of, a bit of a catch-22 because the industry is so small. There is such a concentration. So when you do have an issue like this, particularly if it's, we've had issues with products coming in from overseas as well. How do you ensure that production is there to meet demand, but yet address these issues? I think that's also a bit of a challenge. If I'm not, again, you have better insight on that, but that would be my speculation around with regards to infant formula.
And I think you're absolutely right, David. And in my time at the FDA, we were very concerned about the fact that there are so few manufacturers, and we don't want any of them to go out of business because there are so few, and we don't want any of them to have food safety problems because of the market concentration. So in 2023, Commissioner Califf and I essentially met with all of the infant formula manufacturers and put a call to action out to really double down on food safety, the importance of food safety, the importance of testing and verification of ingredients going into infant formula. It appears that both of these recalls and outbreak situations are related to ingredients. And so making sure that everything is being done to verify the safety of the ingredients as they're being incorporated into the final product. So food safety when it comes to infant formula.
Yeah, Susan, do you have any sense of how many people are working on infant formula at FDA and compared to when you were there?
I don't think they've lost many people. I know they lost a handful. We didn't have many. When I was actually there, my infant formula team was 9 people. I eventually got extra resources from Congress to increase that to 13 people. But with the Human Foods Program reorganization, they've brought more people in, but it's still a very, very small group. That does not include the folks who are doing the inspections. Those are additional. But what we've heard is that the commitments that FDA made to have very highly trained infant formula inspectors after what happened with the Sturgis plant, FDA made a commitment to really have a cadre of really sophisticated inspectors who would focus in on infant formula because it's a unique type of manufacturing with certain unique risks. What we learned in last year was that FDA was lacking half of those infant formula inspectors in the inspectorate. So again, I really hope that FDA can double down on getting those folks on board, getting them highly trained, working with the center's subject matter experts in infant formula to help us all do better so that we can all sleep better, that we have a robust and safe infant formula supply for these babies in the U.S.
Yeah, if there's any matter that should be absolutely non-controversial, it's making sure that infant formula is safe.
Absolutely.
Final question. Let me turn to you, David, first and talk about food additives. FDA has been talking about a rigorous review of food additives. We talked a little bit about GRAS reform earlier as part of its priorities for 2026. Just generally speaking, what is the industry looking for and what are you looking for in terms of food additive evaluation and safety in 2026?
Well, obviously, industry is always looking for clarity. And secondarily, they're looking for a reasonable timeline to, replace or adjust products based on changes. So I think we'll see how far really FDA gets with that. But ultimately, industry wants stability and a long, pathway to know when do they need to have this done. So, we're at the very beginning of that with some of these priorities that have been announced. And I think it's, time will tell really how far the administration and the agency gets with actually implementing some of these, particularly with, the loss of personnel and such during the rifts and departures that happened. So that's I think the feedback we've had, always from the industry side is clarity, length of time to actually put something in, for changes to be put in place.
Yeah. Susan, final word, food additives.
Yeah, again, I think the challenges, a lot of them are coming from the states right now, where the states are saying you can't have a food in our school lunch if it contains additive X or Y or Z. And that's in advance of FDA making any kind of a regulatory determination that those additives are unsafe. So that's chaos for food manufacturers, and I think it's really unfortunate. I think it's really important that FDA go through the proper procedures to get stakeholder input and data and information before anything is done with regard to these additives. We're all looking to see what happens with GRAS self-certification, what that will do. One really good thing that happened last year in 2025 on the food additive side is FDA was able to release the expanded decision tree and that allows them to categorize food additives based upon their hazards. So if FDA does get inundated with a number of GRAS notifications, they're still going to need people to be able to do that. But at least they do have a tool now, the expanded decision tree, that can help them at least make sure that as they're going through, they can triage the additives that they have more or less concern about based upon hazard. It doesn't take into account exposure, so they still have to do more work after they use the expanded decision tree. But at least it's one way to help prioritize the ingredients that they're most concerned about, and it's science-based. And it's been through interagency review and it's been through peer review. And I'm really proud of the work that the FDA has done on the expanded decision tree to keep science at the forefront of how they're going to look at these different food additives.
On that note, thank you both for a terrific session. This has been especially illuminating. The issues in the food area remain top of mind for the American public. We continue to watch recalls. And the FDA needs to continue to be vigorous in its enforcement and in setting the right policies. We're going to turn now to our resource link segment. We provide some valuable links that our listeners might want to check out. These links will all be on our website, fdawatch.net. No need to write anything down. Let's look first at our Pharma resource link. In a recent Pharma Voice Q&A, with Genevieve Cantor, who's an economist and associate professor of public policy at the University of Southern California. She talked about the current climate at FDA. She says it's unprecedented in terms of the depth and breadth of its politicalization. She focused on changes in the pharma oversight area. The link to this article is on our resource link. In the devices area, longtime AdvaMed executive Janet Trunzo retired after more than 30 years at the association at AdvaMed. She has been involved in so many policies involving medical devices over the years. Our link goes to an AdvaMed article that quotes President and CEO Scott Whitaker, the head of AdvaMed, honoring Janet and her work. And she certainly deserves whatever honors she gets. Finally, in the cosmetics area, in an HBW Insight Q&A, Claudia Lewis, who's a partner at Venable, co-chair of the FDA group there. She's a previous guest on FDA Watch. She dives into how cosmetic companies may want to respond to FDA's recent draft guidance on mandatory recalls issued under MOCRA. Claudia warned that recall readiness is no longer optional. And she expressed the view that any gaps in safety substantiation, in GMP controls and documentation and labeling changes can independently support a finding that a cosmetic is adulterated, even without widespread harm. I encourage you to click on our link to see more of what she had to say. And again, all of these links are available at fdawatch.net. On that note, I'd like to again thank David and Susan for being such great guests. This was really insightful. I want to thank our podcast creator and executive producer, Michael Evan Epstein, our assistant producer, Sam Hoffmeister. If you want to suggest any guests for our show, if you want to be a marketing partner, if you just want to comment on the show, you can contact us at info@fdawatch.net. That's info@fdawatch.net. And definitely go to our website, fdawatch.net. You can pick up all previous podcasts at fdawatch.net. And if you're so inclined to give us a 5-star rating on Apple Podcasts, on Spotify, wherever you get your podcast, that really does make a difference. And I remind everybody with every podcast, please do subscribe. I know you're listening to this podcast, but you may not be an official subscriber. If you go to fdawatch.net, it's free. It takes about 10 seconds. You just put in your email address and you click subscribe, and there you go. And you'll be able to receive an email every time we post a new podcast, and you'll have easier access to our resource links. As we say at the end of every episode of FDA Watch, if you really want to watch what FDA is doing, listen to FDA Watch.